So happy days. I was a CEO of a municipality. I had my own house, 5-bedroom storage house with a garage. We had to dispose the car I had. We sorry. It has not been easy to recover.
It has really changed my life. I'm not working. And this is a problem which I was not prepared for. Never be cheated that people who have got cancer are dying because of the disease. People are dying because of lack of treatment, because it is very expensive.
Cancer treatment is long, it's complex, it's expensive. We estimate that about 110 plus people die from cancer every day, and we have 47,000 new cases, and the numbers keep rising. If you look at the demographics of the persons who get affected, is a lot of productive people when they are making important contribution to the economy. If the population is sick or the population is using all their income, all their resources towards treating cancer, towards a member who has cancer, then you can see clearly that we are sitting on a time bomb.
Every Kenyan is one disease away from poverty. One family member has cancer, you will move from the suburbs to the slums. That should not be the case.
2014, now when I was going to Form 2, is when my dad and I were told that this is cancer, and the way it is, it's not good. What we require is an amputation. We were strained financially. After that is when my parents now decided we are going to Ushago. Acha twende tushuko, tumetumia everything we had, our life like imefika mwisho.
From testing, a patient will fork up anything from about 5,000 to 65,000 to even 250,000 shillings just to be tested for the cancer. We have very few oncologists in Kenya, 32 for a population of 52 million. Another financial burden comes when it is the treatment protocol. We see cases where people get into debt, they go to loan sharks, they sell their assets, they do everything, and even after they do that, they're still not able to bridge the gap in terms of paying their bill.
The money that I had taken never helped me. They had not even discovered it is cancer. They would treat me the ENT issue, they would treat the sinuses, they would treat the throat issue, they would give me medicine for the headache. After I become bankrupt, finish everything, is when I'm told it is nasopharyngeal cancer, stage 4B.
This is the third chemo here. NHIF, they paid the bill, but I topped up. I was telling one nurse that I should talk to the doctor so that he may know what to do, whether to stop the last one or what, because I don't have money for the last one.
For the longest time, we have had this narrative that patients present late with cancer. They don't present late. They present to the healthcare system and they are treated for everything else except cancer. What you need are frontline workers who are tuned to think about cancer.
It is important for people to have NHIF. It doesn't guarantee you all your treatment, but it does help somewhere. Would NHIF launch the comprehensive cancer care plan such that it caters for the patient comprehensively, everything, just to ensure that the patient gets their entire package without having to get out-of-pocket funds, just to avoid dropping from treatment.
As a country, we have made quite some significant strides in terms of improving cancer care. In terms of availing access, there has been a deliberate effort to empower county referral hospitals, especially in the public sector, to be able to provide at least chemotherapy. There's also growing investments to make sure that we have a bit more comprehensive cancer centers that are able to provide radiotherapy. We have seen a growth in terms of the human resource capacity when you think about specialists. when you look at budget allocation for cancer care, we still need to do a lot more for disease condition that is the third commonest killer in the country. Then the resource allocation then needs to be aligned to that.
If counties are empowered with equipment, with radiotherapy machines, CT scans, MRIs, functioning laboratories, and personnel, then we would see the cases go down. We will also see the burden of financial stress ease, because if cancer is caught early, it is more affordable than when it is caught late.